I'm so thrilled and honored and grateful to get to introduce you to some colleagues of ours, Chris Cervantes. They, them, keep them from UCI. And yes. Crystal is here in several different capacities. Was a former district administrator, now is at West Ed, also our transgender child.
Give us that perspective today. And then Cleo Ubre. They, them, she, her, lead clinician at APAIT, also a community educator at the OC Jail and OC Sheriff's Department. And then you remember Heidi. Heidi was here earlier. All right, so we'll get started. Thank you so much. Thank you all so much for joining us. It's such a privilege to have you here. I just wanted to get started, giving you the chance to kind of say hello and to everybody and introduce yourself a little bit. But also, we're here today talking about basically the experience of transgender and gender diverse students in school. And want to kind of get your thoughts on that. I know you all have different experiences from which to speak from, but if you could kind of just say a couple things about that for our group, we can just start there. Do you want to start since you're right here next to me?
So again, my name is Britt, and from a professional capacity, I am the program coordinator and community education specialist for the UCI Gender Diversity Program. Our program started in October of 2016. I've been with the program since it started, and we have been and continue to be the only program that is completely dedicated to providing care for transgender and non-binary folks. We have loved to see the growth and other healthcare facilities expanding on offering hormone replacement therapy, but we're just the only ones here that's all we do. That's the only population that we serve. We provide services like hormone replacement therapy, puberty suppression, as well as sexual health education and HIV prevention. My role with the program is really just to help patients and their families as they're navigating their social, legal, and medical transitions. And I do so from the perspective of my personal identity as a transgender and non-binary person. And I myself have navigated transitioning socially, legally, and medically. And so a lot of the support and services that I offer to patients and our family come from being a person that struggled as a young queer trans person in South Orange County. I did not have a very good experience with school. And as an adult, I've really just made it my mission to be that adult and be that person that I needed when I was younger. And I do a lot of community education in the sense that I am working with the School of Medicine at UCI, the School of Nursing, to train future and current medical professionals on how to provide gender affirming care, as well as doing a lot of community panels like this, where I get to work directly with the folks that are providing support and services to transgender and non-binary young people in schools, just because it's just a personal passion of mine. And thank you for being here and listening.
My name is Crystal Diaz, and I get to share today about my experiences as a mom of a beautiful son who is transgender. My son, Kay, came out to me when he was 10 years old, and I would say that there was a lot of fear. And I get teary-eyed, so I excuse the tears that come from a place of love. There was a lot of fear. Just, will my kid be accepted? How will we explain this to Grandpa, Nana, and Tata? Is this real? COVID was happening not too long afterwards. How is that going to affect them? Are they feeling isolated? So forth and so on. So with a lot of support, I'm reaching out to communities like the LGBTQ Center and therapists. We really realized this is real. And this is something that we needed to love and support our kiddo through. So we made the decision to start a new middle school with and give Kay an opportunity to identify as their true self, their authentic self. And I remember going through that experience, and through a suggestion, reaching out to the principal and letting them know what was going on. And I feel like we got lucky in a lot of ways. The principal was very caring. and immediately set up a meeting with us. And we talked through our needs. We didn't do a formal identity support plan. I don't think the principal even knew that that was available to them, but in a lot of ways they did that, right? They sat with us and they just showed us that they cared. And they also gave us a little bit of misinformation sometimes as well. I remember Kay asking, is it okay if we change my name, my email to reflect my name? And they said, no, we can't do that. So school went by, we started off and their email had their dead name. And I was noticing that Kay wasn't participating in their group project. And it was because they didn't want other kids to see their email. They didn't want to email their teachers and ask questions. And then I realized, oh, something's wrong there. So I reached out again to the LGBTQ Center. And they said, no, actually, you can request, a name change. So I went back to the school with this new information. And it took a couple of weeks, but then they got us what we needed. So I had to advocate for my kid. And they didn't know. They were good people doing the wrong things. And there's a lot of the misinformation out there. So it took me as a parent to be able to do that for my kid. And I just find it really hard to imagine a kid that doesn't have me as their parent trying to do this alone. So it's really important, I think, about how important it is to make sure that kids just have systems in place already that make them feel loved and cared for, that they don't have to just be lucky. As now my kids first year freshman in high school now. And we had to go through this again, right? Starting in new high school, kind of that fear of oh, we were comfortable in the middle school, everything was going well. Now we have to start a new system and a new place. And you just go through that process again. And those fears and those anxieties come up again. And this time we had an identity support plan, the high school knew what to do. And it just created a different way of being and it just felt more comfortable. And now we knew what to ask for as well. So as a parent, I think about, how do we help our kids? And then how do we help families as well? So thank you for being here today and listening.
Everyone, my name is Cleo Ubre. My pronouns are they, them, their, she, her, hers. And I work in the community center called APAT down in Garden Grove. And I primarily work with adults at the clinical level. And so I don't see too many kiddos. I see them when they're in their adulthood. And so I kind of have seen, some of the ways in which they have been brought up, the circles that they have lived in for a while. And they kind of come to me, unfortunately, when they've experienced trauma or violence, homelessness, or in the jail, incarceration. So I'm kind of seeing the latter stages of what happens when folks aren't supported in the circles that they need to be, whether at home or in school. So that's pretty much where my perspective is going to be today. So thank y'all.
Thanks, everybody. And so we gave our folks here an opportunity to submit some questions ahead of time. Britt, you said something earlier about wanting to be that adult that you needed when you were younger. And I think the folks that are here would want to be that adult for our kids. So maybe you can give us a sense of some things that help, some things that hurt, some things that would have been helpful. And then also, each of you actually, and then also, I think there's sometimes, like Crystal mentioned, where somebody tries to help, but it actually doesn't really help. So can you speak to that?
Yeah. So in terms of, I have two clear examples, or a clear example of something that hurt and somebody that helped. When it came to the teacher that hurt, I was 16 when I started dating girls. And at that time, I was considered a girl that liked girls. And I had shared with some friends that I was dating a girl, and folks that I thought were friends ended up sharing that with other people, and I was outed. There was a teacher that had found out about this, and she just kind of joined along with the other students in bullying me, in making comments and saying things. And her and her husband because her husband was involved with the school as well, said a lot of really homophobic things about the person that I was dating. And At that time, I didn't know that what I was experiencing was a lot of anxiety and depression, and I didn't really have very accepting parents, or at that time, my parents weren't accepting. And me being outed at school led me to needing to share this with my parents because my mom was very, very involved in the school. And I knew that she was going to find out eventually, and I'd rather it be from me. And I was met with rejection at home as well. And really, truly, the only thing that kept me in school and kept me feeling like maybe I wanted to pursue trying to see what the future would be like for myself was a teacher that was extremely supportive. She reached out to me and said, I see you, I see how much you're struggling. I see how hard this is for you. I know that your mom is also not accepting you. And she just opened her classroom. And it wasn't even just to me that she opened her classroom to. It was really any student that wanted to come to her classroom. She didn't, at the time, because I went to school, quite a while ago, not a long time ago, but at that time, it was still really not okay for teachers in South Orange County to have pride flags in their classrooms. But she did what she could to try to make herself seen as the inclusive space that she was. And there are all kinds of students that were in that room, folks that were playing D&D, folks that were just really a lot of times just considered like the weirdos, but I fit right in with them. And that was where I felt most comfortable. That's where I felt accepted. And I went there every day for lunch. She helped me with all of my classes. She helped talk to all of my other teachers about the fact that I was struggling. And I was able to patch back up and graduate on time with my other classmates in that year. And it was just so incredible that it was just such different experiences within the same school district, within the same time. And I was met so differently by this other teacher. And we're still family friends with her and her wife. And she taught me a lot about just existing as a person and as an LGBTQ person is okay. And folks can have normal and boring lives. I love that my life is boring. I don't do a lot of the things that I used to in terms of going out and marching and advocating in the streets. Just being there and being visible and being an ally, I think is going to go a lot farther than you actually think that it's going to go. But I wouldn't be here if it wasn't for that teacher. And I think about her constantly, and I have thanked her over the years before what she did for me and how she helped me.
Oh my goodness. Yeah, seriously. Thank you for sharing that. Do you all want to share? Is there anything that kind of comes to mind for you?
I mean, I would say that the most boring thing about me is that I'm trans. But I think to kind of go along with what Rick had said, I think it's really important. I mean, I'm not really sure if, I think that as long as a person within the school is willing and open to supporting and caring, I think that effort and that intention can go a long way, a very, very long way. Even if it is the person may not have like the pronoun usage or the sentence structure, or, the practice or whatever the case may be, I think that intention and that effort and just that kid seeing that, okay, there's some compassion here. You may not be able to comprehend, but there's compassion that's there. And oftentimes, as I do train and do talk to people, I always try to emphasize that it's not necessarily about the comprehension, it's about the compassion that really matters. I don't know a lot of things about the LGBTQ plus community because these things, culture is expanding, gender is expanding, these things are expanding and evolving over time, right? Cultures evolve over time. And so I don't know everything, all the small nuances about the LGBTQ community. So I don't fully understand it, but I have compassion. I'm culturally humble, and I come with openness when it comes to nuance and individual people. And I think that's what's most important for people to be an ally or an accomplice when it comes to supporting that kiddo.
Yeah, one of the things that we talk about is like this work is really just about kindness and respect. And when we're working with folks or training, like we didn't do definitions today, we didn't do, because you don't need to know all that stuff. It doesn't, and it changes all the time. And your kids will explain it to you if you ask them to. I don't know what that means. Do you mind telling me what that means to you? And most of the time, I mean, every single time I've ever asked that question, a kid will explain it to me. And it's probably way more nuanced than I would have ever realized, So, yeah, kind of all goes back to that. I know we have some folks here that sent questions in about younger kids, elementary school, that kind of stuff. So I want to just ask if y'all want to speak to that a little bit. I think one of the things that we talked about earlier in our session is how we'll have transgender students come in at school when they enroll. So that could be as early as TK, now pre-K, which is 4, right? Can come to public school. And at that point, if we know that we have a transgender student, it's typically because their parent will come and enroll them. So, and then if that doesn't happen for whatever reason at that time, those kids will typically start coming out around 5th grade. And then, more over time as they enter puberty, right? But if we can kind of talk about younger kids and experiences that you might have maybe in your clinical experience about families and kind of what they're going through or things that we could be aware of. Maybe you have some thoughts on that.
For us, when Kay was younger, for me, this kind of came like a shock to me when they were 10. It was not something we really kind of talked about. So when they shared that with me at 10 years old, my first reaction was like, you're too young, right? You're too young to kind of, and it's interesting because as an educator, that's not the reaction I would have had to any of my students with a child. It's like, you're too young, right? So it was kind of like, I made the mistake of saying that out loud to my kid, right? So they kind of like hid it away for a couple of years as well. Like they were still feeling the same, but they were performing for me, right? They didn't want to see me disappointed. So, like I when my son said, oh, like, I want to buy some like mascara, like I took it as like, oh, okay, they don't really feel like this anymore. And like, I'll get you all the mascara and the lipstick and this and that, right? Like I was trying to create something that just wasn't. And I regret doing that, right? I regret being that way. And as a parent, I don't know if this answers your question, but as a parent, I think you like I said earlier, you're just fearful. You're just fearful that they're not going to be accepted. And this was talked about earlier. Kids are very accepting. It's the adults often that are not so much or don't understand or don't want to understand or kids are very accepting. So like a lot of the fears that I had were not real. Right. So, and that was kind of like just me. And I think I projected a lot of those fears on my son as well. And then also like thinking back, and this probably doesn't, now I'm going on a tangent. Sorry, Lindsay, but as you start sharing with other people too, then you get also their fears, right? So like you start, like, as we shared with our families, then it became about my mom worried about, well, what did you do to cause this? Or, and it became a lot of that. So you have to be careful. Like I had to realize, like, I couldn't put this on my kid all the time. Like I was putting a lot on my kid and they had a lot to deal with already. Like, and also take care of me and take care of Nana, take care of how other people felt. Right. So like, how do you just normalize this? Because it's normal. There's nothing wrong, And a lot of it too is just kind of like these heteronormative ideas of like what things should be, right? That kind of causes your kid to feel like they don't belong because you're adding to that. So I think for an educator or LA or anyone that works with kids, just like, there's nothing wrong. If you approach it with that lens, there's nothing wrong here. Let's find something to celebrate, to affirm, to kids will know. Earlier you asked about like, good practices and how can we stand for kids? And I was mentioning earlier that the principal was just like so loving. And she didn't know everything, but my kid was willing to like gravitate to her because she saw that she was loving. And immediately the principal was like, okay, this is what we're gonna do on the first day of school. All the teachers are gonna do an activity where they learn the pronouns of the students. And that way we don't just call out your kid, but we'll like make it more inclusive. So that was an activity that she purposely used at the first day of school. And it just made such a difference for like, my kid came back like so happy after that first day of school. So it's just like, how do you just be kind?
I have some teachers who've suggested putting pronouns on every worksheet. Just name, date, pronouns, or name, pronouns, date, whatever. Just on every worksheet, so it's kind of ubiquitous. And teachers have shared with me that over time, those pronouns may change, right? Like they have a student who then changes their pronoun in the course of the year, and it gives the opportunity for the educator to go and have those conversations, But it creates that space where you're inviting openness, right? Thanks for sharing that. Cleo, one of the things that you and I have talked about in the past that I think is really important, I don't know if you all find this at your sites, but one of the things that comes up sometimes is the idea that in school and school-age kids, frequently we have kids who are coming out as non-binary or kids who are coming out as transgender male, right? Maybe more commonly than we have kids who are coming out as transgender female. Does that track with your experience on school sites? Mm-hmm. And I wonder if you could share some thoughts with us on why that might be.
Yeah, I think it's been an hour just on that alone to talk about that. It's so complex and wrapped up in layers of these big words like patriarchy and misogyny and sexism, right? And I think that when it comes down to it, femininity is policed a lot more than masculinity. And I think that a lot of the kids who are trans femme, who know who they are on the inside, have seen the difficulty that it is to be such a person out loud in these spaces where said thinking is policed so heavily, right? And so it may be harder for them to do so because they know that they can experience a lot of brutality and be bullied, not just by their peers or teachers, but also by their parents. And so I think that when it comes down to it, it's really hard for some people to exist in those spaces because of the heavy policing that it comes with and the potential violence as well that they see along with the rhetoric that there is, right? Because our society is heavy with misogyny and sexism and patriarchy. So how dare you try to denounce who you are and join this other side? How dare you try to take on this thing that we're trying to police, right? I think that's pretty much the shorter response I can give. There's a lot more nuance with that conversation as we talk about the ways in which things are done and the agents, the perpetrators, those who benefit, and those who are somewhat protected by this thing called the patriarchy. But it's a heavy conversation with a lot of different factors that kind of interwoven with our community. And I think that for someone to go against that thing out loud, it's very disruptive and can be met with a lot of agitation and aggressive people. And that's my answer on that.
Oh, that's a deep answer. I mean, even the first thing you said, it just kind of blew me away. We have, for example, words to describe maybe cisgender girls who are expressing in traditionally more masculine ways, right? You can be an athletic girl, and even though we do police femininity, I think we've spent a lot of time in our culture trying to give girls more options, more pathways, more, you can be the president, so they keep telling us. Believe it when you see it. Yeah. But you can. When I was growing up, it was like there were tomboys, right? But I don't know a word that would describe a young cisgender boy who is expressing in traditionally female ways. There's not even a word that I can think of.
That's positive.
Right, that's positive.
Yeah, it's not derogatory.
No, that's actually such an important distinction. Exactly, that's exactly right. So it just doesn't even exist as a space. And a lot of what I hear you talking about is about safety or lack of safety. So when we look at data and we look at CDC data, because I think another piece to this that comes up for me is there's also this implication that kids assigned female at birth are maybe more, there's like this kind of sort of subtle implication that kids assigned, maybe what this means is that kids assigned female at birth are more likely to succumb to peer pressure. And so this is a fad, right? That there's transgender boys who are coming out as a fad. Do you have any thoughts on that?
That's another one.
I told you it was gonna be an easy question.
I hear that a lot, that right now that there's like this social contagion. I hear things about rapid onset gender dysphoria, which is not real.
It's not a thing.
And I think Crystal kind of touched to it a little bit of where, you shared that your child came out to you and you said something and your child internalized that and just kind of kept it quiet. That doesn't actually change your child's identity. My parents said things to me that were pretty awful when I came out at 16, and it didn't actually change who I was. I just hid that person from them. And we as trans folks and as people, we hear things from other people and we internalize that, and we if you hear it enough, you believe that about yourself. And so if you hear about yourself enough that you are other, that you are odd, that you are ugly, that you don't deserve things, or that you don't deserve to exist, you internalize that and you believe that to be true. And so you just don't share these things with other people. And so when I hear rapid onset gender dysphoria, that is your perception of your child's identity. That's not actually how your child felt. That is how you saw things, but you don't know, you won't think back about the things that you said offhand or directly to your child about their identity or how they're presenting, but they'll remember. I can remember some very clear statements that were made to me and how I presented, and I don't think the people that said them have even thought twice about it. And so we carry that with us and we hold on to it, and that just, some people aren't ever able to get out of that, and because they're never met with the love and support that they need in order to be able to come out of that. And so with these conversations that I hear about people's identities not being real, that's just invalidating their experience, that's invalidating their pain and what they're feeling, and that doesn't actually make it true for the other person. Just means that they're not being given the right to exist as they are. And so I hear that a lot, and it is frustrating for me as a trans person because I can think very clearly about those things, but I really would like for folks to kind of think more about the things that they're saying, because this isn't just impacting trans folks. Gender is a performance that we are all performing in our own way. It's just, it's a much more challenging performance for trans people because we have a lot more limitations and roles that we have to follow to be seen and affirmed for the people that we are.
And I just want to say to Britt's point, one thing that I'm hearing is that it can be very dangerous and has some pretty serious long-term effects when a child is, when they have their parent or their caretaker instill self-doubt within them. it's very, very powerful. And it causes serious long-term effects because this person goes on into their adulthood being uncertain about so many different things regarding their life because of that thing that their parents said to them, which instilled so much self-doubt to where they are unsure about where to go, where to find safety, what's real in terms of their friendships. It's a lot of different anxiety within their different circles and aspects of their lives comes up later on in life because of that installation of self-doubt. And so for someone to be told at a young age, it can be really harmful as they go into adolescence, into adulthood, etc. So I really try to help people understand how it can be serious, that type of emotional support, just not being there for that person.
So a lot of themes coming up around safety, right? And around, I mean, something that's coming up with all three of you is how really life-changing it can be to have a supportive person. You know, and we've kind of talked about these safe spaces, right, as they're called now, or you mentioned pride flags in a classroom, right? That's one of the things we talk about is signaling safety. You know, wearing a pin, having a sticker. This is Irvine. That's their sticker. You know, having those kinds of things, and you're basically saying to a community that is vulnerable and traditionally ignored, which means marginalized, right? Hey, when we say we care about our students, we mean specifically you also. We care about you specifically as well, right? There's other school districts that have done transgender flag hearts, those kinds of things to really kind of bridge that gap and try and open that conversation with those students. So even if your district is not doing this, if you're in a position to make this possible for your district, I highly encourage it. If that's not really your role, you can do it in your space and in your room and be that teacher, you know, or that GSA advisor, you know, those folks that where folks know and the kids talk, so they know who they can talk to and who they can tell, right? Another thing, not to belabor this point, but this has come up a lot recently, is when we do identity support planning, thinking about our own bias around gender, misogyny, patriarchy. You know, I know those are, like you said, big words, and we don't have time to totally go into that stuff, but what I can tell you in practice is that, is there a difference in the way that your school reacts to a transgender boy using the boys' locker room or going on an overnight trip, and the way they react to a transgender girl using the girls' locker room and going on an overnight trip? Because we get those calls all the time, and there's a difference. And from my experience, what I see is, and then I want to throw it to you all for comments, is that when we have a transgender boy using the boys' facilities, people are going on overnight trips, people are concerned that particular student might be at risk. They're concerned about that student's safety. When we have a transgender girl using the girls' locker room, the girls' facilities, and going on overnight trips, people are concerned about the safety of those around her. Does that make sense? Which is, and all the things that come of that are extremely discriminatory. Somebody say that? Yeah, discriminatory. Like, if, you know, so having to kind of work through that with staff. I don't know if y'all want to say anything about that. Has that come up for you at all, Crystal?
What it makes me recall is when Kay first started middle school, we initially, well, Kay wanted to just use a restroom by themselves that was separate from the boys' locker room. And so we did that, and actually, like, I was happy about that. Like, I felt safer. And then when Case said, you know, I want to use the boys' locker room, my first instinct was like, no, absolutely not. Like what if you get hurt? What if someone like tries to hurt you, right? So like all these things came up. And I actually talked to Lindsay. I have a great support system. And, you know, one of the things Lindsay coached me or helped me think about is like, well, just, you know, have a what's wrong? Like, what are you worried about? And I walked through what I was worried about and said, well, have a conversation with the principal and talk about like how we might talk about those safeties. That have you had an opportunity to tour the boys' locker room? Have you had an opportunity to pick the best locker room? Do you want to be closer to the PE teacher, further away? All these things that I didn't even think to ask, right? So, you know, when I approached the school about moving them, they were concerned right away too. And you could tell right away that well, are you sure? Because we have a great, you know, the way things are working are fine. It's like, well, no, this is what my child wants. So I let my kid have a conversation, and I sat and we were together with the assistant principal, and they said, oh, I already have a plan. Like, I have a friend in that class and we're good. As long as I'm by him, like, I'm fine. So we made it we escalated the level of concern, and it was a non-issue at the end of the day. Like, there was no issue. And Lindsay says this often is kids are the best assessors of their own like safety, right? They know what feels safe and what doesn't. So like a lot of times we have these adult conversations and we forget to involve the kids or even ask them what they need, right? So like once we were able to just like get out of their way, everything was fine and it was a non-issue.
I'm glad you brought up the non-issue, and then Lindsay was talking about those fears, because there is no documentation of actual incidents of those fears. It's all been about creating barriers and utilizing fear to do that. So there actually is no evidence of those safety issues per se, as far as, you know, the reverse or the safety factor.
Yeah, in fact, what the data does show is when we have more restrictive bathroom and facilities policies, kids are more at risk for assault and harm than when we let folks, you know, choose what feels most comfortable and safe. So, yeah. So, and in 10 years of doing this, we've just never had an issue. Never had an issue of student safety when students are supported in using the facilities that they feel most safe to use. Okay, so I want to ask about some of our, I want to ask some of our pre-submitted questions, but we had a lot of questions about parents' perspective. And I know you've said some things and you've touched on some things, and I want to highlight one of the things that you said. As a parent myself, it's very scary. It can be very scary, right? Like this is the thing that has come up a lot that you've talked about even just today, is that there's a lot of fear because you want to protect your child. I've been doing this work for a long time. And I have a 4-year-old who is diverse in their expression, in their gender expression. And so I've had to figure that out over the last couple of years and lean on some of the folks who've been there for me. And this is a totally different side of things, right? As having all of this knowledge and doing all of this work, and then having my own child and being like, oh my gosh, right? It can be really scary. It can be really scary because you want to just support your kids and say, yes, do whatever you want to do. The world is beautiful. And then you also want to protect them. And something you said earlier, Crystal, about like every person that you kind of let see your true family or you came out to, right? You have to deal with their feelings. One of the things that came up for us, because ours is so young still, is that I had to make myself notice positive experiences. So like, say my little one would go out in public dressed how they want to dress, which is very gender nonconforming. And we would go to the store and say somebody at the store would say something affirming and beautiful and wonderful and nice. And then I would have to go, okay, I have to notice that experience and go, okay. And each time take a breath and go, okay, you know, this is going to be okay, because the alternative is me saying things to my child that they might be saying in your office in 25 years, right? And I just am not willing to do that, I guess. So these are the things I think that our parents are struggling with. And when our parents come to school, you know, and say, hey, how can you help us? It's scary. Crystal, can you speak to this idea of like not wanting to make waves or not wanting to be a burden?
You know, it takes a lot of, it takes a toll to ask for anything, right? Like when we would ask, like, can you talk to us? And it's like, oh, like, I'm not sure if they want to talk to us, and like we're bothering them. The principal's so busy, and this is just one kid, and right. And then it's like, okay, can you talk to us about the restroom? Can you talk to us about what teachers are allies? You know, like everything just felt kind of like we were bothering. Versus like, you know, so I had that experience, and it just, you know, like my kid felt that even more so than I did, right? Like we just felt like, gosh, we're bothering, and it's fine. You tell us that we can't change the email, then we won't change the email. It's fine. We'll just let it be. So like, just so much misinformation about what's right and what's not, and then you go online and you try to figure it out by yourself. And I'm an educator, and I was supposed to know, right? So that like having that experience, and I purposely put myself in a role where I was in charge of these things now, right? It's because now I knew better. So as an educator, as an administrator, I was able to like, you know, when principals called to ask questions, I was able to say like, no, this is the law. This is how we act, and this is a good practice. What was your original question?
We love where you're going.
I know. You kind of were going into my next one. I was like, yes, perfect. I'm not even sure I remember my original question. Basically talking about how it feels to like this idea of being a burden.
Yeah, you know, and as an administrator, I was able to sit in on many identity support plans and hear from parents who were also felt like they were burdening the system, right? You know, when we started high school as well, I went to the orientation before school started and had asked someone, you know, like, hey, like we would like to go through an identity support plan. And the person I talked to said, we don't have that here, right? And it's like, oh, well, we probably do. And I said, and then right away go back to Lindsay, what do I do? And Lindsay says, offer them this identity support plan, email them and say, okay, you don't have one, like, can I use this one? And you know, I didn't hear back for a while. So you go through that like ladder of inference, like they're not supportive, they don't like us, like I need to change districts, right? Like that's where I went. And it's just that I talked to the wrong person. You know, later on I talked to the right person, and they're like, actually, we do have an identity support plan. And actually, this is the process, and you know, and this is who can. Let's meet next week, right? So it makes you think about like how these tools are only as good if you put them in the hands of many people, right? Like, right? There's so many great tools that you just don't know about, so it's like, how do you make sure that these tools are like, that all counselors know about these tools, that all administrators know about these tools? Because one day a kid's gonna walk in without their parent and need something, and they're gonna get the wrong information, and they're just gonna let that sit for the rest of their lives. Versus, you know, where I was able to go back and say, well, actually, we need this, and then finally get connected to the right person. So just that like, how do you even remove the need for kids to ask for things that they don't even know about? And just make it part of the way we do business and part of the way that we show we care.
Right. And I think one of the things that we always talk about is we can have all these great resources and tools, but if the student doesn't know about it, what's the point? Right. So when we have districts who have Instagram pages about, you know, for this stuff and really are reaching out or putting it in student agendas and parent handbooks and all these places so that there's visibility about the resources that are offered, then, you know, that's how we can, and in your GSAs, you know, you have a focus group right there in your GSAs. And those kids, you have kids who aren't coming to your GSAs, but they're going to hear about it from their peers, right? So when we think about identity support planning, I know you're familiar with this process a little bit from your work, and we talked about what it is a little bit, but just providing an opportunity to have conversation with a student, either by themselves confidentially or with the family, like Crystal's kind of referring to work with the school so that the school knows how to best support the student. That's kind of what we're here talking about today. And I wonder if the two of you could speak to what that might have been like, or things that maybe we can open the door of conversation about that might feel supportive to kids in that space. I'm guessing there was no identity support plan process when you were in school.
When did this actually come about? Like, it said May or whatever, the email said that you guys passed the bill in May. When did they actually start doing these plans?
Oh, it's been over 10 years. Yeah, but every school district is adopting it at different rates and different plans, and sort of everyone's kind of, there's no there's no law on how it's supposed to happen, right?
And in Orange County, OCGP doesn't have like a uniform thing that everyone is supposed to get.
No, and in Santa Ana, we're actually ahead of the game, I think.
Wow.
Yeah.
And you just adopted it in May?
No, well, I'm just gonna make myself part of everything.
We adopted a board policy in May that specifically protects transgender, gender non-binary, gender non-conforming kiddos. But identity support planning was around before then.
Gosh.
Yeah, we're just getting specific language in SAUSD to solidify that.
So as you see people come into your practice, families come in, and are you still like available to families when they first kind of come into the practice? Is that still?
Yeah. So I'm still, our team has expanded, thankfully. And so it's myself, and we have a principal advent worker that is helping with families as they're navigating things. The question of trying to think about what that would have been like for me, I think things would have been a lot different had I had those as options as a young person. I probably would have come out a lot sooner, because I didn't start my transition until I was in my 20s. And so it was actually a partner that I'm married to that was like, I think you might be trans. And I had no idea what that was. And so I was just seeing what it's like now for students it has been so, like, a lot of the work that I do for community education with schools specifically is like on my own time. And when I hear about how that is helping students, it is why I have continued to do that work. Because I hear from these students of like, oh yeah, I just came out to my school and they helped me with this, they helped me with that. I'm going to be on the boys soccer team, or I'm going to be on the girls swim team. And it is so different. And especially at the school that I went to school at, hearing how their experience is so different from my own is exactly what I wanted. That is the work that I have just been trying to do, because that is just has been my life goal. The saying, like, you reap what you sow, I don't think you always do. A lot of times you don't actually get to enjoy what you planted, but it's for the people behind you. And that has been what it feels like for students. And so these support plans are so important to make students aware that it's there for them as an option, so that they understand, like, these are my options. I'm not limited to these things. I'm allowed to take up space, because that's something that I know that my family struggled with. I know that I struggled with for a very long time. And these support plans are, no, you are here to take up space, and we're going to help you do that. And I just think that this work should only continue. It should only expand, because our community is expansive and we deserve to have all of the space that we need to exist authentically.
Right? Yes, we do. And really, that's just about equity, just having equitable access, right? Cleo, I know you've talked about kind of, you see these kids when they become adults and they come in for treatment of, trying to kind of sift through some of the things that they weren't able to to really process in their developmental stages where they should have been processing it. And I just want to see if you have anything that you want to share with us on kind of the what helps, what hurts thing, and how we can change things earlier to provide more helpful developmental pathways for those kids.
I have actually taken on a few cases for kiddos, but they usually are the ones that are really severe and acute. Parents who are like, hey, like my kid really needs support because, in the last 6 months, they've been to the hospital like twice. And I can't help but say yes to help that kid, because there has to be some space in which that kid does feel safe and protected. And I think that it can be hard for some parents to bring their kid into therapy, because some parents want things to go back to normal. And some parents want to figure things out, in which case I say, come into therapy yourself, not your kiddo. But I would say the thing that I try to tell parents whenever I do have rare cases is that my only agenda here is to make sure that your kid lives into adulthood. That is my only agenda here. And if we can collaborate on that, then awesome. But other than that, I'm going to affirm your kid. And it's less about this person who has suicidal ideation silo, right? It's interconnected. It's because this person does not feel safe at home and or at school. So how can we get everyone involved to be a part of that care team? And I think it really is important to be part of that care team. And I say that because that's kind of like what I'm bringing into the medical space, right? Yeah. They're the care team full circle holistically. They're the care team that help the kiddo while they're in hospital. There's the continuity of care, which I'm a part of. And then there's trying to get the kiddo back into the school and back with their peers so that way they can graduate and live out whatever dreams they want to dream, right? And so we kind of need a lot of different people to work as a team. And I think it's so important to get administrators as well as staff on board with helping support the kid, give more compassion, maybe a little more attention. Sometimes people see things, ask questions. I mean, I think that it sounds like a lot of folks here do care and want to be a part of that care team when it comes to the kiddo, which is awesome. And, administrators can be everywhere at once, so it is really, really hard. But I think that as long as information is available and maybe even circulated often, I think that it can really be powerful, because you don't know what you don't know. And so folks who do go to these conferences, do go to these panels and these meetings, it's so important for us to share this information so that other people can have this information as well and continue to provide more support throughout the school. Because there may be some kid who's not saying something, and their frustration, their anger, their sadness may be coming out in other ways that isn't quite understood. And so I think just kind of being openly affirming and openly supportive by wearing things like a badge or a sticker, or the case may be, can let the child know that you are safe. You're a safe person. You are an affirming person. I can come and talk to you if I need to come and talk to you. To maybe help a space that I don't have at home, right? Because some kids spend more time at school than at home for various reasons, but.
Thank you for that. And this is one of the things that we talk about all the time, is signaling safety. Sometimes it's like, people want to know, like, what's the magic thing to do? And I think it's actually so simple that we sometimes miss it. And it's really just being kind and respectful to everybody. Like, it really just comes down to that, and offering that, and kids see that. They see if you have, because again, they're evaluating risk, right? So if you have a sticker or a badge or something on your computer, they notice that. And whether or not they come and share their story with you, they're going to hang out in your classroom, they're going to hang out in your office, they're going to know that this is a place that is safe, which is so crucial. I mean, the story that you shared, Britt, is almost like saved your life, this one teacher. got you caught up on credits, you said. Just having this person to provide support and having these places where we can be affirmed and really just kind of loved for who we are can help us become more open and positive about who we are. We're out of time, but I wanted to, Crystal, give you an opportunity real quick if you wanted to share anything about kind of like if there's something that you want us to walk away with, what would it be?
So as I was navigating how to be a parent and how to be a better educator, I was going through my doctorate program. I'm on my last year of my doctorate program. And when I first started, I was going to focus on professional learning for new teachers. And that quickly changed to more inclusive practices for LGBTQ students. So I'm on my last year thinking about how do we bring identity support plans to the hands of many. So I'll be working on my study this year to train counselors and make sure that they have time to just feel comfortable doing the process. Because I think sometimes, if you just treat it like a checklist, that's not going to help a kid, right? But if you treat it like a loving conversation and really show that you're invested, that's going to make all the difference, right? So how do we get people to know about this tool, to practice it, to use it, and then share it with as many people as possible? So I'm really excited about that work because I think that this is going to make a difference for all the kids that we interact with, right? So just please share, and then invite Lindsay's to your school because this is such a great resource, and it can't just you can't just depend on one or two people to do it.
Yeah, and it kind of goes back to what Cleo was saying and what we've been talking about the village, right? We're all part of the village, and we're literally at the village. Thank you to the village for hosting us. Did y'all want to add anything before we wrap up and let these folks go? I don't want to cut you off. There's something that you want them to walk away with that you haven't already said. I want to give you the opportunity.
Power of an apology will go a long way. You will make mistakes. You will misgender people. You will make assumptions about people. You'll do things wrong. And I grew up with adults not apologizing to me. And so it's really important to be an adult that apologizes and to have your apology with actionable change and just differences. So just it's okay to make mistakes. Just use that as an opportunity to apologize, educate yourself, and move forward in an affirming way.
Yeah, I would say that kids understand vibes. And so if you have a warm vibe or open vibe, okay, this person's cool. I may not have seen that rainbow or that pronoun sticker, but they feel cool. And so I'm gonna talk to them about this thing that I can't talk to with anyone else. So I would say kids know vibes.
For sure. All right, well, do y'all mind sitting here with us for the next 5 minutes while we kind of wrap up? But before we go to that, can we just thank them and appreciate them for sharing with us today? Just thank you so much. I really appreciate it. Thank you. And then as Heidi and I want to wrap up with you, yes, we can come to your site. We would love to. We'd love to help. Feel free to call us, email us. And then Heidi, you have this slide here.
I feel like this slide really connects with the panel. I just want to thank the panel for all the messages today. And I think it really connected to our theme today, just meeting the moment. And when you have those moments with individual students, never underestimate how much that moment needs compassion and kindness, means to that student and the work you're doing. So again, as we said this morning, thank you for being here for this. And thanks for the panelists for reinforcing that message that we can never have too much kindness, or we always have enough time for that special moment, for that individual who really needs us. But this work saves lives. That's why we're all here today. And I'm sure you all believe that. That's why you took the time to be here, because we all know in education, we're all balancing lots of different responsibilities, lots of hats. So thank you for prioritizing that time. And, this is more than, we did provide you a small segment on the laws just to give you that information, but this is not about laws. Equality is not just about passing laws, but it's also about the struggle within our hearts and our minds and being there for the community as well as our individual students. That's where it counts. And so we just want to thank you for being the hearts and the minds of our for our students. So thank you very much.